Hello and welcome to A Functional Approach with Dr. Jim Chialtas. Today I want to talk about functional medicine. I wanted to revisit the topic today and really demonstrate the differences between a mainstream approach versus a functional approach. I offer a modality that kind of lends itself to helping the body reestablish function. It's something that we would kind of assume from all medical experiences, but the mainstream approach to health and wellness might not be the best pick a lot of the time. A primary difference is symptom control versus digging deep and finding root causes. I'm an acupuncturist by medical license, right? So that allows me to practice this functional medicine modality. I can order blood tests, I can order other laboratory tests, and I can diagnose conditions and treat within my scope, meaning herbs, nutritional supplements, diet, lifestyle, consultation concepts. A Chinese medical approach really does look at the root. We would say the root and the branches, like a tree, right? The branches and the leaves are the symptoms. Yes, I'm experiencing stomach pain. Yes, I'm experiencing migraine, right? If we go into the mainstream approach and you tell your doctor I'm experiencing migraine, most likely you'll be given a prescription for Imitrex or one of those types of medications because that's going to tamp down the symptoms of the migraine. Migraine is occurring, but we're just kind of overriding the symptoms so that we get through our day. Potentially a very important concept, but what does that do for the migraine next week, right? And the month after that, and the people that suffer chronically. The bottom line is we're going to try to tamp down the symptoms most of the time, with a few exceptions. If you have a bacterial infection, you'll get an antibiotic, which will cure the infection, and that's a root cause. So that's step one. Are we treating the root? Or are we treating the branches? So I have to reach to my acupuncture kind of theory in that concept, but it's the same for functional medicine. We want to restore function. If you're my patient, you might tell me 20 different things, right? It's my job to know what's the root. So what is different about how we work up a case? You go to your doctor, you get your blood drawn, right? You go in for either a general wellness checkup or maybe you have a complaint and you get the panel that you get. And we've all seen them. So you have your tests and you have your numbers and then you have your reference ranges, right? This is the biggest difference between a mainstream and a functional approach. You want to be in range, obviously, right? The more things you have popping out, the sicker you are generally. Right? But what's really important to understand is those reference ranges are not based on optimal wellness. We would hope that they are, and we would think that they are. I would expect that they would be. Right? I'm going to my doctor to remain well. But quite literally, those reference ranges have gotten bigger and bigger over the years. Think of it like a bell curve. So hands down, undeniable, we have gotten sicker as a population over the past 50, 60 years. My grandpa's generation was much healthier. There was much less obesity. There was much less diabetes. There was much less chronic disease, right? 50 years ago. And so the average number of people that come in to get their blood drawn had better ranges. So those reference ranges were tighter, right? Now, when we get our blood drawn, we're being compared against a very sick population and a population that's on a lot of medications that, guess what? Alter our blood chemistry levels. The biggest difference is a functional range is tighter, right? It's based more on optimal wellness, not on pathology. Pathology is disease. Don't be satisfied with waiting for disease to set in, because at that point, it's much, much harder to fix, right? And we want to work not only on longevity here. We don't want to just live old and all that. We want to work on the wellness part of it. We want to have a health span, lifespan versus health span. That's a big, big difference, right? Well, I want to live old, but I want to live old healthy and hiking the mountains and riding my bike, right? And holding hands with my wife on the beach. That's important to me, right? And I think it's important to you as well. We do that by keeping ourselves in tune with those wellness ranges, right? So we want to see the whole panel because that starts to give us clues into where's the problem. Where is the problem exactly? This is functional medicine, right? We understand the larger picture. I think that's a really, really important thing to seek out as a patient, right? Very, very important. Those two concepts, I think, are what really make us stand out the most. I suppose if I were to add a third, it would be time. Time spent with patients. When I work with somebody, the initial phases are investigative. I'm beginning to build my working diagnosis, my medical hunch based on what we have right now, right? And that can change. A working diagnosis can change over time. And it will, because if I'm working with you for 6 months, 12 months on a chronic case, you are going to change, and therefore our focus will change. We need to remain fluid, right? Not protocol based. I learn everything I can about you, and I sit down after you leave, and I write up a 4-page report. It's me working for you. It's my investigative time, right? It's my thought time where I'm really determining what that modality needs to be, what the diagnosis is now, what it could be in 6 months, right? That is functional medicine in a nutshell. And I look forward to continuing my discussions about this. I think it's a much needed topic. If you are looking for a functional medical consultation, if you have any kind of chronic illness, really of any kind, I'm here for you. And I have certainly remote Zoom type consultations available. And if you're in the San Diego area, by all means, love to see you in person. So hope you found that interesting, and I look forward to continuing the conversation. Thank you so much, everybody. My name is Dr. Jim Chialtas, and this is Functional Approach. Bye-bye.